Your vision is your guide. Protect it before it's too late. Good afternoon, dear listener. Welcome to Eyes on the Road, your go-to show for expert eye health insight. Proudly brought to you by Lagos Traffic Radio 96.1 FM. It's the last week of March, the Glaucoma Awareness Month, and today's show is special. It is Open Day. We are wrapping up a month of eye-opening discussions with a bang, including Dr. Imade's new book launch, which is Glaucoma, the Silent Thief of Sight. Get ready to call in and join the conversation. My name is Taiwo Barua, standing in for the usual host on the show. Yes, Akanu Sen is not on ground today, so I will be doing the needful. Quickly, let's tell you what the roads are looking like before we get down to business this afternoon. I did say earlier that most of the roads we're tracking on the big screen in the studio are all looking very, very good. Ikorodu Road from the rear, whether you're coming in from Mobolaji Bank, Anthony, or you're coming in from Idiroko end through the Independence Tunnel all the way down to the Alaro Inward Jota and Kitsu, it's a smooth one. Aside, slight slowing down around major bus stops. For those of you using Lagos-Ibadan Expressway also, you have slight build-up on the Fakol Bridge due to the failed expansion joint, but it's really nothing to worry about. On the entire stretch down to Alakpere, you have nothing to worry about. It's free movement. No fail queue around MRS, just if you're wondering, looking very good. Latif Jakone is also in good shape at this time. Alternation by Wemco, Omole, and the likes on the entire stretch by Mobile, right? But it's really nothing to worry about. Likewise, Idimongoro also. All right. On our in-house program today, talking about today's edition of the show. This month we have covered glaucoma from types, risks, causes, management, and ways to prevent early blindness. Now it is your turn. Our in-house doctor on the show, Dr. Priscilla Imade, is unavoidably absent today, but we have capable hands joining me on the show to do justice, all right, to your eyes' concern via calls and messages, of course, through the WhatsApp. Like I usually say, I prefer it when you connect with me on WhatsApp. That way, I can easily access your concerns. Joining us on the show is Dr. Aderibigbe Emioluwadamisi, an optometrist from Modern Eye Foundation, and Dr. Nkechi Ugboh, a member of Nigerian Optometric Association, also an optometrist at Rhemahad Eyes Clinic, Lagos. Doctors.
Good afternoon.
How are you today?
Fine, thank you. How are you?
Thank you for having us.
You know, I like the way doctors sound. I mean, is this a consulting room kind of voice? I mean, we don't whisper here. Yes, we say it out loud.
Good afternoon.
Good afternoon,
everyone.
How are you today?
Very well, thank you.
So it's good to have you.
Having us in the house.
It's good to have you on the show. Can we have a recap of some of those parts that we missed, you know, in the course of the month, the areas you would like Lagosians to focus on from the beginning of the month? Yes, please.
Okay, so basically we talked about glaucoma, we've talked about the causes of glaucoma, we've talked about the risk factors in glaucoma, we talked about diagnosis and management. You know, glaucoma is a very deadly disease, even though it doesn't seem to appear so, because it doesn't usually present with early signs or symptoms, early symptoms mostly. So the people who have glaucoma, if anyone is experiencing it, they usually do not see the signs, except they visit their eye care specialist, of which it could be detected or diagnosed in the hospital. So it's quite risky, and like the name, we usually cap it the sneak or the silent thief of sight. So we've had all this with Dr. Imade, I'm sure would have done justice to all the explanation and all that. But it's important that we find time to check our eyes at least once in a year, but we will usually advise that you check your eyes twice annually. So for today, we'll just be taking the questions coming in from our viewers.
All right, Lagos, while I ask you the next question, let me tell you that you can be a part of this conversation this afternoon. via WhatsApp. That's 0809-9120-777. You can also put a call through to 0915 387-7127. I'll take that again, 0915 387-7127. If you're listening to the show for the first time, the program is Eyes on the Road. Here, we talk about care for your eyes. You know, you can ask us any question concerning your eye. We have experts in the house that will certainly proffer solution to those challenges. All right, Dr. Aderibigbe, why don't we see the signs of glaucoma early?
Okay. So, from what we know, or what we've been saying and what we're being taught, glaucoma is a silent thief of sight. Forgive my voice, everybody. I have a bit of sore throat.
Sorry.
Thank you very much. So, glaucoma is a silent thief of sight. And then, this is because there are no symptoms to glaucoma. You can only see the signs, and it's the person that sees the sign is your doctor, the optometrist. You by yourself won't know that, glaucoma has already started taking place in the eyes, because there are no symptoms. You don't feel pain, you don't feel discomfort, you don't feel anything. The only thing that is taking place is that the vision is gradually being taken, the sight is taken away gradually. And then what makes it even worse is the fact that the sight that is being lost is not starting from your central vision, like when you are looking straight ahead. You are still seeing clearly, but then your side vision, your peripheral vision, is gradually taken away by this condition or this disease called glaucoma. Glaucoma is the leading cause of irreversible blindness in the world. So the end stage of glaucoma is blindness. It can only be managed. There is no cure for glaucoma. There's only management for glaucoma. And then when it is not now detected early, when you start noticing what you call the symptoms, when you start noticing, my vision is blurry, it's like I cannot see, and you are seeing those symptoms at that stage, then it's already at the end stage. It's already at the latter stage, the advanced stage of glaucoma. So the only thing you can do at this point is to always go to have your eyes checked up. Have a comprehensive eye examination. Let your optometrist check your eyes and tell you the state of your eyes. So if there's any sign that they would see while they carry out their different investigations and their examinations for your eye, they can let you know, and then management can start taking place from then. With that, you are able to preserve your sight for as long as you can. So yeah.
All right then. There are some questions that we received earlier, from some listeners. Can you walk me through, or walk Lagosians through some of these questions, and then you respond to them?
Okay, there are quite a number here, but we'll just see how far we can go. We have from Chinedu, says, my name is Chinedu from Ikeja. I recently heard that glaucoma is called the silent thief of sight. Please, what are the early signs to watch out for, and who is most at risk? Dr. Aderibigbe have actually answered that. Yes, because usually you don't get to see any sign yourself. The signs are only seen by your doctor. When you are in the clinic, it's seen by your optometrist, and then by the time you begin to experience symptoms of glaucoma, about most times over 50% damage is done, most times, for a lot of people. So you begin to experience these symptoms at a much later stage, when some damages which are irreversible, like she implied, has been done to the eyes. And at this point in time, it's only what is left that can be managed. So whatever treatment you are being given by your doctor is necessarily not going to improve your vision, but rather it's going to preserve further loss of vision, or reduce it to a large extent, at least to keep your eyes going for a very long while. So it's very important that you don't wait to see feel any symptoms. It's better for you to have your eyes checked, see your optometrist, and then they can see some very early signs. We keep saying early detection is key in glaucoma management. The good thing is that if it's detected early, your vision can actually be preserved. A large percentage of a vision can be preserved till way into old age. But if you don't do anything about it, you're waiting to see it get a symptom, then it may rather be too late by the time you're coming into the clinic.
Okay, so I would also take another question. Thank you very much, Ma. So this is from Grace from Yaba. My uncle was just diagnosed with glaucoma and he's really scared. Is there a cure for glaucoma or will he eventually go blind? So I'd said earlier that there is no cure for glaucoma. Glaucoma has no cure. I think that's exactly why it is irreversible. If there was a cure, then it would be reversible, right? So there's no cure for glaucoma. The only thing that can be done is the management and the preservation of the sight that is left. It depends on what stage the glaucoma is. So depending on what your vision is or your sight is at that point in time, it can be managed for a very long period. So no cure for glaucoma. However, management can be done. So for your uncle, Miss Grace or Mrs. Grace, he should just follow the prescriptions and the plans that his optometrist or his doctor has given to him. He should not miss his medication, because the moment he starts skipping medication, damages begin to take place in his eyes, and then it can lead to the blindness that we are trying to prevent. So he should go to his appointments as often as he is meant to. He should not skip his medication. Take your medication, very important. Use your eye drops. I know sometimes it can be very, very hectic having to use your eye drops every single day for the rest of your life, but then it is all for your good, so you can keep your sight. So yes, use your medication, keep your appointments with your doctor, follow all the advice and all the plans your optometrist has for you, and you should be fine. Thank you.
All right, Lagos, Nigeria. You're tuned to Lagos Traffic Radio 96.1 FM, and the program is Eyes on the Road. You must be wondering who I am speaking with today. I have Dr. Aderibigbe Emioluwadamisi, an optometrist from Modern Eye Foundation, and Dr. Nkechi Ugboh, a member of Nigerian Optometric Association, also an optometrist at Rhemahad Eyes Clinic here in Lagos. Quickly, let's tell you that report from Victoria Island says the sending from Ekwen region with Bonny Camp roundabout is very appreciable. But you have it building up underneath the bridge due to alternation. Bonny Camp in Wadamadu Bello way on route Adetokumba Ademola to your co-hotel is encouraging, while it's building up from your co-hotel entrance to your co-hotel roundabout due to closing hour rush. All right, let's have more questions from you, Dr. Nkechi.
Okay. It says, my father had glaucoma and lost his sight in one eye. Does this mean I will get it too? What can I do to prevent it? Olayemi from Surulere. Olayemi, thank you for your question. That your father has glaucoma doesn't necessarily mean that you would have. But we always advise people, because one of the risk factors of glaucoma is a family history. And that your father has it means the family history here is quite strong. So we would advise you or to tell your siblings, even for your children, everyone have to have their eyes screened for glaucoma. Because family risk, family hereditary, it can be hereditary. One of the risks there is the fact that it can be hereditary. So that your father has it is a very, very strong sign that you may, but not necessarily have it. So the best thing is to have your eyes checked. Ask your siblings to have their eyes checked. Your children should have their eyes checked, because now we know that that glaucoma is in the family. And with management, like we said, if detected early with management, you are fine. So early detection is key. Please keep close to your optometrist, have your eyes checked, and ensure that you keep to your appointment.
All right, hold your thoughts. Hello, Elder, tell buddy. Good afternoon, sir. Thank you.
I need the doctor there.
Yes, the doctors are listening.
Hello, sir. Good afternoon,
sir.
Good afternoon, well done.
Thank you very much.
And thank you for all the good job you are doing.
Thank you, sir.
I have a suggestion that can't this issue of this eye problem be introduced into schools early enough? You know, teachers deal with many of these children from the youth. So if my suggestion is clear to you, if you catch them young from school and send them to the clinic, I think that will help a lot. It's a suggestion.
Thank you, sir.
Thank you so much. Elder Tawagwade is a regular caller on the show. I mean, virtually all our programs here on Lagos Traffic Radio. Thank you so much, Elder Tawagwade, for your suggestion there. That is as good as you saying that do not drink and drive, do not smoke. These are things that we tell our children from a very young age. But then we can also inculcate all of these habits, as it concerns their eyes also. Over to you, doctors.
Thank you, Dr. Elder Otobagbe. Thank you. That's a beautiful suggestion from you. We have advocacy programs that we are running all over the country from Nigeria Optometric Association, and also we are creating awareness, and then we also have vision corridors that we are creating in these schools. So we've actually been to most of the schools, and we're trying to see how we can get to schools in difficult to reach places in inner cities and all that. But most schools, we try to create this awareness with the teachers, and then we put vision corridors. The last time we celebrated World Optometry Day and World Sight Day, October, we created vision corridors for some schools, and then we taught these teachers. We tried to train the teachers on how to identify vision problems, because we found out that with vision problems, children tend to do poorly in school. And a child, you don't miss what you don't have. So some of these children don't even know that they have eye problems. So the first people usually that would notice is either the parents at home or the teachers in school. So we try to create this awareness, train these teachers to identify these problems so that they can communicate to the parents to take these children to see their optometrist. So thank you. That's actually in place, and we are creating awareness and trying to get the government to do more. Thank you very much.
Okay, thank you very much, Ma. So there is also a question from Uchenna from Festac. My eye doctor said my eye pressure is high, but I don't have glaucoma yet. What does that mean, and how can I bring my eye pressure down? Okay, thank you very much, Uchenna. So, if your eye pressure is high, you should know that it is actually a risk factor for glaucoma. You may not have glaucoma yet, but it is a risk factor, meaning that eye pressure needs to be managed. It needs to be brought down with the use of medication. So there are medications that you can use to bring down high eye pressure. High eye pressure is known as ocular hypertension. So just as you have your high blood pressure, you have the one for the eye, and then it needs to be brought down. It should be managed. It shouldn't be fluctuating, going up and down. So your doctor is going to help you in the management of that eye pressure. You should always go at least 3 months, be checking your eye pressure to ensure that it is on a good level. Now, the normal range for eye pressure is between 11 millimeter mercury and 21 millimeter mercury. That is the normal range for your eye pressure. Anything that is above 21 millimeter mercury is already termed high. So you need to do well to make sure it is not above 21 and within 11 to 21. It should not even be on the borderline of high. That is 19, 20, 21. If you can, 19 is fine, 20 is okay. But then for someone with already with a history of high ocular pressure, that's high eye pressure, you should do well to maintain it at a good and low level,
All right.
within the normal range.
Dr. Aderibigbe, let me come in there.
Yes.
It's a common knowledge that to improve your eyesight, generally for your well-being, you should take vegetables, fruits, and the likes.
Yes.
For these pressure on the eyes that you're talking about now, are there foods that this person can actually consider eating? Are there healthy lifestyles this person should consider to put it to check? Because yes, medications can be expensive, but food cannot be as expensive as medication. Are there things he should be doing to ensure that it doesn't get to the point of having to buy medications?
Okay, thank you very much. So there are food that you can eat for healthy eyes, to have healthy eyes. There are food that have what we call antioxidants, eye antioxidants. So we have things like omega-3. We have food that's like carrots. Let's just give examples of this food. Carrots, you have your leafy vegetables, you have your fish. very, very, very rich in all these eye antioxidants. So you can eat those meals to keep your eyes healthy, supply the nutrients you need for your eyes. But for high intraocular pressure itself, now there has to be an underlying factor that is causing that high pressure.
Okay.
Now, could it be trauma? Was there trauma to the person's eye that raised the intraocular pressure? Is it that there is actually glaucoma already taking place in the person's eye? Is it that there has to be something that has
Triggered it.
Yes, triggered that high intraocular pressure. So that thing would be figured out, and that thing should be managed. Like now for glaucoma, we know that, okay, it's glaucoma that's causing that pressure. You manage the glaucoma, the pressure is also brought down. If it's trauma, you treat whatever it is, whatever is the underlying
Mental
cause,
health.
yes, of that. Thank you very much.
I would just add something to that. You know, talking about food or lifestyle, even though it's important that you take leafy vegetables, carrots, and we have them here. Sometimes we try to look for these things in foreign lands, but they are here with us. Our ewedu, our efo, these are leafy green vegetables. Our garden egg, even sweet potato, is very good. It's quite rich in beta carotene. You can take all this, but it's not going to take the place of your glaucoma medication. Exercise is also very good. Very good. As it is good for the whole body. Remember, the eye is a part of the body. It's not as if you're talking about something separate, you know. So these are also very, very important. Now, you can also experience cases where patients have glaucoma with normal tension. The pressure is not high, but there's glaucoma in the eye. So in as much as we could tell you the causes and the risk factors, I mean for glaucoma, there are times when we don't even know. There are some cases where you don't even know what's causing this. If the pressure is normal, because the only risk factor you can manage in glaucoma really is increase in intraocular pressure. But when the pressure is normal, what do you do? So that's why you need your specialist. You need your optometrist who will come in and be able to manage this condition for you. So for our friend here who has sent in the message about a pressure being high and yet it's not yet glaucoma, I would advise her to keep close to our optometrist, have her eyes checked all the time, because increased or ocular hypertension can also lead to glaucoma at the long run. So it needs to be managed, just like Dr. Aderibigbe has said earlier.
All right, we'll take the last question from Dr. Aderibigbe.
Okay, so we have a question here saying,
The last question.
my father's vision has been getting cloudy and the doctor said he has cataracts. Okay, this is not glaucoma anymore. Okay, can cataracts be treated without surgery, and is there a way to prevent them? Okay, this is from Aisha from Kara. Now, cataracts, the treatment plan for cataracts, when it has gotten to the mature stage, is surgery. You have to take out the cataract lens, replace it with what is called surgery. So yes, that you can use to manage that. What can be done to prevent them? A way to prevent cataracts. Well, cataracts. Okay, so I'll start with this. You have to protect your eyes from the early stages before you start noticing, oh, there is cataracts in my eyes or anything, before your optometrist notices it. So one thing is sunlight. Sunlight can actually affect the eye by causing cataract, prolonged exposure. So you have to protect your eyes from sunlight, shield your eyes. Studies have shown that sunlight can actually cause cataract. Another thing, systemic conditions, diabetes, blood pressure, high blood pressure, hypertension. You have to manage those conditions if you have those conditions, because one of their complications is cataract. So manage your systemic conditions, take your medications often, go to your doctor's appointments, don't miss your appointments, and then yes, that can be managed here.
All right, then. I'm glad that we're able to touch the two major eye challenge. That's the glaucoma and cataract there. And then let them say you're doing shakara. Wear this thing and cover your eyes, because it is good for your eyes. Protect your eyes, all right? And then you're protecting your skin also from the ray of the sunlight. I have been speaking with Dr. Aderibigbe Emioluwadamisi, an optometrist from Modern Eye Foundation, and Dr. Nkechi Ugboh, a member of the Nigerian Optometric Association, also an optometrist at Rhemahad Eyes Clinic here in Lagos. Save your sight, secure your future. Early action stops glaucoma's silent theft. If you missed any part of today's show or previous editions, you can always catch up on our Facebook page and YouTube channel. That's at Lagos Traffic 96.1 FM. Search with the keywords Eyes on the Road. Yes, today's edition has been produced by Micah Arocha. Of course, Dr. Priscilla Amade is not here today, but she is the consultant optometrist at Modern Eye Foundation and a fellow of both the Nigerian American Academy of Optometry and the Nigerian Optometrist Association. For inquiries, you can visit +16 to 18 Ogunosi Road, opposite Omoli Estate Phase 1 by Akiode Bus Stop, Ojodu, Berja. Or you call the number 0803 333 6672. On behalf of the production team, led by Micah Arocha with assistance from Danon Toby, our executive producer is Tayo Akonli. I am Taiwo Barua. Eyes on the road, your safety, our priority. Lagos Traffic Radio. See you next week.